Good day, colleagues, ladies and gentlemen. It is such an honor to be back at the International Conference on Social Work and Sciences towards One Health and Sustainable Development in 2022. I am Lucé Pretorius from the Northwest University in South Africa, from the Community Psychosocial Research Entity. Today, we will be talking about sustainable programs to ensure the safety and safeguarding of social workers. So you might be wondering, how is this topic relevant to sustainability? And we are going to talk about that in just a moment. Sustainability entails addressing our own demands without jeopardizing future generations' ability to meet their demands. So it's basically living in such a way that all of the living systems can live independently and indefinitely. Environmentalism does form a very important part of sustainability, but economic development and social equity also needs to be addressed when we talk about sustainability. That means that natural resources, as well as financial resources and social resources, needs to be explored as part of this topic. So when you look at the screen, you see the diagram that I've put up, which talks about sustainability in the environment, the durability of the economy, as well as social persistence as part of the sustainability picture. Just to explain this in a bit more detail, the circles that you have just seen on the screen forms a picture of what would be an ideal world of sustainable development. In this world, we would have sustainability in the environment, where humans consume natural resources at a rate which allows the nature to regenerate itself, maintaining ecological integrity and keeping all of the Earth's environmental systems in balance. But at the same time, not only having sustainability in the environment, but also durability of the economy. This would mean, in effect, that human communities all over the world are able to keep their independence and have access to resources which they require to meet their needs, both financial and also non-financial. In this sense, economical systems would remain intact and activities such as secure sources of livelihood would be available to everyone. In an ideal world, we would also have social persistence. So social sustainability or social persistence means that universal human rights and basic necessities are within everyone's reach, and everyone has adequate resources to maintain families and communities' safety and well-being, and everyone is healthy. So healthy communities have leaders who make sure that everyone's personal, labor, and cultural rights are upheld. So when looking at that picture that I have previously shown you, you would see that in an ideal world, we have all three forms, the environmental, the economical, and the social part, form part of sustainable development. So how is this relevant to social work safety? This is about social persistence or social sustainability. And I want to say this again to emphasize its importance. Social sustainability is about human rights, universal human rights that states that all basic necessities are within everyone's reach. We are talking about safe and healthy communities with leaders who ensure that everyone has personal, labor, and cultural rights that are being just and that are being upheld. Sadly, colleagues, friends, ladies and gentlemen, we have not yet achieved sustainable social sustainability within our own social work community, within our profession. Considering recent media coverage, sustainable motivations have been complicated, personal, and extremely diverse. And it leaves the question about what future are we leaving for the generations of social work professionals to come? Is it a sustainable one? If you were to look at the following pictures of media that has been circulating over the past few years of social workers, the question comes to mind, is this sustainable? Literature confirmed that physical violence, emotional abuse, verbal abuse, sexual abuse, and destruction of property will occur at some point during the career of a typical social worker. The primary mission of the social work profession is to improve human well-being and to help meet the basic needs of all people, with special attention to the needs and empowerment of those who are vulnerable, disadvantaged, and impoverished. The question therefore remains, who is responsible for the safety of social workers while they are taking care of society's vulnerable, disadvantaged, and impoverished? Ladies and gentlemen, colleagues, the rationale of this study for sustainable programs to safeguard social workers was to eventually develop a policy framework to enhance the protection of South African social workers against client violence. This formed part of a multi-phased larger studies with various goals and various methodologies. During the first phase of the study, we explored the nature of client violence against social workers and the factors that could contribute towards this phenomenon. This was also part of a presentation at this conference during last year. We also explored during part 2 the extent of client violence against social workers in terms of the risk that South African social workers could explore and their lived experiences regarding social violence. During phase 3 of the study, we identified relevant international and national policies, frameworks, guidelines that could inform the development of a framework that could protect social workers. And during phase 4 of this study, we designed a concept policy framework that was reviewed and refined before it was submitted to relevant role players. And this is the part of the study that I would like to tell you a bit more about today. sustainable programs to safeguard social workers. So why did we create a policy? It's important to note that client violence has been a typical occurrence in the social work field, be it nationally, internationally. During the past more than 10 years, it has been a typical occurrence in the social work field. Yet no formal measures have been offered to address this, especially in a South African context. Here we also do not have any formal database where incidences of client violence have been reported, and neither the current policies or any national legislation currently provide for the protection of South African social workers in their workplace. So the purpose of the policy framework was to provide a platform for policy development and implementation within the field of social work. This policy recommended strategy to prioritize social work safety, as well as measures to develop proactive approaches to client violence. It also had recommendations to improve social work safety and security, and some initiatives to protect social workers at work, during field visits, and when they are traveling. So the suggested programs and sub-programs can be used as a starting point for implementation, whereafter organizations or agencies, even departments, could develop their own programs to protect social workers in their offices. So without further ado, and before I tell you about the research methodology, it might be a good idea to just get a broad overview of the proposed policy. So, like I said, this framework can be used as a foundation to create and implement additional programs. So the further objectives of this policy was to prioritize the safety of social workers in organizations, agencies, and departments in South Africa, to develop proactive approaches to prevent client violence and keep our social workers safe, to promote the safety and security of social workers, and to implement practical strategies to safeguard social workers against client violence at work, during site visits, and while traveling. So we have then considered various programs, we've considered beneficiaries, we've considered stakeholders, and at the end of the day, we proposed 3 programs in this policy framework and also various sub-programs. And this was based on research from previous phases of the program. The first program was making the safety and security of social workers a national priority, which consisted out of sub-programs, namely a national reporting database, and then managing the consequences of perpetrators of client violence. At this stage, there isn't really consequences for the perpetrators, so we proposed some very specific consequences for client violence perpetrators to be there. The second program was named the Establishment of a Safety Culture in the Workplace, which consisted out of sub-programs, the formation of a safety committee within an organization, department, or agency, the implementation of measures for reporting, and we also proposed a specific reporting format which could serve as an initial guideline and then amended by organizations as they have an individual need. And the third part consisted out of an appropriate post-incident procedure to follow after social workers have been exposed to any type of client violence. The last part of the program was to be developing and implementing measures to enhance social work safety. This was a very practical part of the policy, which really gave practice-specific measures of what you can do to implement and improve social work safety. It also came with very practical resources and templates like posters and additional resources which could add to the practical understanding of this. So we had sub-program 1, which is general measures that can be put into place. 2, physical safeguards in the workplace. 3, ensuring a safe interview environment. That is what you can do while you are having an interview with clients. 4, keeping safe while traveling. And 5, during field visits, what you can do to be safe there. So now that you understand the framework a bit better, I can tell you how we came up with the idea. The design of the concept policy framework followed the Bridgman and David policy cycle paradigm, and it was informed by all of the other phases of the research. So this was national and international literature found during the scoping review. It was informed by our data from our quantitative questionnaires, our qualitative interviews with South African social workers, as well as international data from our applied thematic analysis. So what we did was we took the framework that was presented to us, to experts in the South African social work field, through a policy Delphi process in order to review our proposed policy framework and to refine it and make it even more better. So who was involved in this? We involved experts in policy formation and implementation in South Africa, who we identified through snowball sampling. And eventually we had senior management from the Association of South African Social Work Education Institutions, the South African Council for Social Service Professions, some of the oldest non-government organizations in South Africa, and the South African Associations for Social Workers in Private Practice. And all of them helped to improve the relevance, efficiency, feasibility of our policy framework by providing quantitative and qualitative input on the proposed policy framework. So how did they provide their input to us? We used a policy Delphi questionnaire to allow the experts to collaborate on the decision-making process. It was designed as a 9-point Likert scale, a quantitative one, and they also had an opportunity for qualitative comments. And you know, the thing with a policy Delphi process is there's always a question of when should you call it a day? When should you stop? And we followed the literature guidelines, which says that the purpose of the research and the sample numbers and the level of agreement should be your guideline when you follow a policy Delphi process. And as soon as the experts' conclusion was the same and it supported each other, and the Delphi results was the same, then we knew it was time to call it a day. So what did they find? Which input did they provide? Their input was in terms of several themes. We categorized it into 4 themes and sub-themes, which was their overall impressions. And they had, in general, really positive feedback about the policy framework that was presented to them. Some proposed adjustments in the paragraphs and the phrase arrangements, and there was the technical and language editing that was proposed. Here and there was a bit clarification of ideas that was asked. In terms of usability of the proposed programs, both general and program-specific ideas were provided, and these were incorporated into the consulted framework in order to refine and improve the efficiency of the consulted framework. Some identified obstacles was probable financial restrictions in the implementation of the proposed programs or ineffective human resource management procedures. An important point which was mentioned by several of the experts was that a policy framework would not necessarily improve or ensure a social worker's safety, could contribute to it, but eventually social workers does remain responsible for their own safety, and they should take responsibility for their personal safety as well. Lastly, we found a theme for additional considerations in their feedback, and some said that it might help to identify social work safety as an organizational risk and establish essential strategies to address it as such. Funding suggestions were provided by the experts, and it was underlined that more research was necessary, as well as some strategic instruments that needs to be developed in order to make this even better. So overall, ladies and gentlemen, colleagues, there was a few key findings when developing this policy framework, which I want to revise and emphasize. And these are that a consulted policy framework was developed as part of this multi-phased research study, and we reviewed it by experts in the South African social work context. Seems like client violence in social work is a common, nearly daily occurrence in South Africa and internationally, yet it is underreported. And if the precursors to and consequences of client violence could be addressed on a national and organizational level, client violence might be reduced. Social workers would be able to deal more effectively with incidents of client violence if they are supported in a national and organizational level. Adopting policies and procedures to safeguard social workers has been a very common response internationally. And this consulted policy framework can offer a foundation for the formulation and implementation of social work policies to safeguard social workers against client violence at work, during site visits, and traveling to and from work. Social workers and departments or agencies can use this suggested programs and sub-programs of the policy framework as a starting point for first implementation, after which they can design their own protocols and protect their social workers. So what can we do to further improve this? Well, national stakeholders should take note of this policy framework and start to develop it into a formal policy that can be used in the industry. And sponsors should be lobbied in terms of funding to ensure successful execution of policies like these. because client violence incidents have to be reported and recorded on a formal database developed by national stakeholders. Every social worker who gets hurt on the job, whether it be physically, emotionally, verbally, sexually, or their property being damaged, is one too many. And violence as an element of practice management should be included in undergraduate modules in social work curriculums at higher training education institutes. And bodies like the South African Council of Social Service Professions or the National Association of Social Work should encourage social work practitioners to attend continuous professional development, continuous professional education, trainings that focuses on this topic. Employers of social workers should be encouraged to adopt internal safety policies and protocols that prevent social workers from experiencing client violence. Trade tools can also assist social workers to be safeguarded in the environment and should be motivated and developed. Individuals or interdisciplinary collaborators should research this topic further internationally or on a national level, because there is still a rich field of information available on this topic. Finally, it is true that many individuals and organizations see the value of sustainability, which they demonstrate in their policies, in their daily activities, and in their behaviors. There has been a significant move already towards sustainability, and we are thankful for that. However, if we do not devise solutions towards the social conditions within our own profession, we will continue to be the targets of client violence, and the social work profession, as we know it, will not be accessible to future generations. It is time to take control about it. It is time to safeguard our own. If you have any further inquiries or comments on this, you're more than welcome to contact myself or Professor Anita Herbst, or visit the institution's website, where we will be glad to answer any of your questions. Once again, thank you for having me and allowing me the opportunity to form part of this amazing conference. Each and every small step, efforts will lead us to success. Let us make our efforts, our success, together for each other, leaving no one behind. Let's make sustainable programs to safeguard our social workers.